DJ Super J. Lens FM.
Namaskar and welcome to Super J on the Move. Today I'm in the offices of Miss Anju, Ranjan, the Consul General of India in Johannesburg. And this morning we're going to be chatting about India, how it has been responding to the COVID-19 in India, as well as its global assistance to the world. So with that I say good morning and namaskar to Madam. How are you doing?
I'm fine, good morning.
You're looking very calm and relaxed in this stressful situation.
We have to, because lockdown is not easy for everyone. You should know how to deal with it.
Correct, yes. Yeah. So before we get into the interview, I just want to give our listeners and viewers a little background on the stats for India and how it has been responding to the COVID-19. So on 22nd March 2020, India observed a 14-hour voluntary public curfew as a request from the Prime Minister, Mr. Narendra Modi. The government followed it up with a lockdown in 75 districts where COVID cases had occurred, as well as all other major cities. Further, on the 24th of March, the Prime Minister ordered a nationwide lockdown for 21 days, affecting the entire 1.3 billion population of India. On 14th April, the Prime Minister extended the ongoing nationwide lockdown to the 3rd of May. And recent stats as of this morning, 16th of April 2020, 12,456 total cases. 10,520 are active, 420 have sadly deceased, 1,513 have recovered. So Madam, on to you now. 2/3 of India's 1.3 billion is rural, spread over 728 districts in 650,000 villages. To understand how India is managing the COVID-19 on the ground, could you please tell us how it was managed in the district of Bhilwara in Rajasthan, which has a population of 2.7 million people?
As you said, that Bhilwara is in Rajasthan with a 2.7 million population. It is a textile base and famous for the textile industry. One doctor who was working in a private hospital became the source of the infection, and 27 cases were reported on 19th of March. And then the district administration took a lead, and then first they locked the whole district. They imposed the 144 in the district, and it was locked down from outside contact, all public private transport. Everything was everybody was appealed to stay inside the house. The food were delivered at the doorstep. All the essential items were delivered at the doorsteps, and this aggressive model was followed. They took 6 steps basically to contain the infections. First was the district isolation, as I said. Section 144 Code of Conduct was imposed throughout the district. Then mapping of the COVID-19 hotspot within the district, that which are the area cluster which is infected more, were mapped, identified, and the strict vigil was done to ensure zero movement of the people. People may not like, but this was required. Then door-to-door screening. The medical doctors and then paramedic, they visited door to door, from house to house, like they are doing in South Africa.
Correct,
also.
Yes.
And they tested the people, and they visited not only once, twice, they visited thrice, till they came to know, because the cases the gestation period is around 14 days. So if you have the repeated screening, then only you will be sure that you are not infected. Then aggressive contact tracing. Suppose one person is infected, so then his mobile phone and his movement was mapped and then traced that where he has moved, then where he has spread the infection. Okay. So that was done. Then that all these people whom he has visited or who he was in contact with were put in the active quarantine. No absolute contact. Then the quarantine facilities were increased. The number of bed, number of hospitals, they were brought into the surveillance, and the people were given the complete quarantine and no movement at all in the hospital itself. And then rural area, you know that monitoring in rural area was very, very important. As you said, that a lot of villages in India.
Yes.
So then all the clusters we were detected during the mapping area were monitored, and administration increased the monitoring in the rural area and enforced complete lockdown, no movement at all. And that's why, out of these 27 cases, 17 have been recovered. There have been 2 deaths, unfortunately, and all of the 11 have been discharged from the hospital. They went back. So this is the success story, and Bhilwara is known as, they say that Bhilwara has become the India's leading district. BBC has reported, and this model should be followed all over the India, not only all over the India, but across the world.
Yeah, so India has been proactively combating COVID-19 in a way unknown to many countries, using the enormous human resources and technical prowess. Just some history here. India started to actively screen and isolate travelers since 18th of January, that is 12 days before the first case was reported on the 30th of January in India, whereas Italy started only 25 days after its first reported case, and Spain only 39 days after the first reported case. So apart from the early screening and lockdown, what other proactive measures are being put in place, and how are they being carried out in India?
As India is an enormous country, and then we are in a contact with so many other countries, so many flights are coming into India. As you said, that we started very, very preemptive and then very proactively, we started graded lockdown, you can say, and checking at the airport. Some of the flights coming from the infected country, first of China, Italy, were stopped first, and then by the end of the 10th of March, before the WHO declared it the world pandemic, India was prepared for the lockdown. For the lockdown, and we were screening at the airport, even as you mentioned that even before the first case detected in India, because we were aware that how open our borders are, and then how much the infection can come into India. Then even the phase 1 infection had not occurred in India. We were quite vigilant, and then at least in the inbound and then outbound flights we were tracking it, and on the 55th day of the first outbreak in China, we were practicing the complete lockdown in India. So that was a very, very active step. The Prime Minister had also announced that the Janta curfew, so that he wanted to give a feel that how the people are responding, and then wanted to know the people's response. And followed by, after 3 days, we went into the complete lockdown, and then the lockdown has been extended till 3rd of May. So we were doing on every front. We are trying to combat this battle with the invisible enemy. We also developed an Arogya Setu app, which forms an user database to create a network of information that can alert citizen and government of potential victim of the coronavirus. The app is available in the Google Play Store and then Apple Store, both. So it has been downloaded by the 50 million people in 13 days, and has beaten Pokemon Go record, which holds a record of 50 million downloads on Google Play in 19 days in 2016. So in 13 days we broke that record. And following Prime Minister's address on 14th April 2020, which announced extension of lockdown till 3rd of May, the app downloads surged from the 39 million to peak of 100,000 per minute. You should also download it.
Okay. Yes, certainly. Yeah. Can you give us the name of that app again, please?
It's called Arogya Setu app. I'll write it for you.
Alright, thank you. So medical equipment like masks and ventilators are becoming a high in demand globally. How is India planned to meet this demand for its people, especially those in the rural areas?
Government has dedicated a package of US $1.9 billion to the health sector for dealing with COVID-19 situation, and the mask, all the 2-ply, 3-ply surgical masks, and N95 mask and hand sanitizer has been declared as essential items, essential commodities up to June 30th, 2020, and their export banned. We banned the export from January itself. So from January we are not exporting any of this sanitizer and all these things. And then we have ramped up our production and procurement of essential PPE set, ventilators, testing equipment. The fortunate thing is that we were producing everything in-house. So then just we had to give a boost. And we have already repaired so many tens thousands of ventilators. Private sector is being fully involved in the quest to make the affordable local alternative as well. And we have like 32 Indian companies that have started work to produce PPE kit up from the zero at the beginning of the year. So we have ensured a 6-fold increase in the supply of oxygen for medical purpose since February 2020. So we were like we first put a ban on the import, export of our material and then everything. The self-help group in Rajasthan and then other parts of the India also, you can see that they are making the mask at the home actually. Okay. And that is the very encouraging thing, that self-help group has been like encouraged to make the mask. As the 2-ply and 3-ply mask, you can use any cotton cloth and then you can stitch and then make the mask. So these are the welcoming, these are the way we are coping up with the COVID-19. It's not easy with a 1.3 billion population and kind of so many villages, and the potential to spread the disease is so much. So we have to combat at every front.
And as you can see, I do have my mask, and we are having our social distancing during this interview.
Yes, you are like more than 2 meters away from me.
Yes. So this pandemic is new to most of us, if not all. Do you think that there is enough medical staff and training for the medical staff to handle the situation in India?
Training of doctors and paramedic staff working at the airport, port, identified hospital, and then rapid response teams in field, we have been doing. They have been trained in the management of MER COVID outbreak, similar virus reported from Middle East. So then we had the trained staff. More recently, these RRTs of all state airport health officer had also been trained on management of high-risk pathogens in context of Ebola virus disease outbreak in Democratic Republic of Congo. That time also we had trained people. This is being addressed as part of the preparedness towards COVID-19 screening. So we had some training earlier, so that is coming handy. Apart from this, national level of training for trainers started on 6 macro followed by the state level training on 9th and 11th March. So every state, health is a state subject in India. So every state is taking whatever possible step they can take for the training, and then having the paramedic updated. And we have to also keep them safe, right?
Correct, yes.
So on all front, on 21st March, web-based training on ventilators management by AIIMS, our biggest hospital, was the mock drill for corona preparedness in all hospitals across country. AIIMS has been conducting series of training for Indian Medical Association and private doctor also, as for the other designated hospital. So we are continuously evolving the training. We are doing the training of the trainers, and we are using the experience of our previous trainings.
Okay, so what about the capacity of hospitals and beds for the corona victims? I'm aware that some trains have been converted into mobile hospitals. Any other avenues being looked into?
We have readied 520 dedicated COVID hospitals with nearly 85,000 isolation beds and 8,500 ICU beds. We have also prepared 5,570 additional health facilities, which will bring in another 197,400 isolation bed and a further 30,700 ICU bed. So we are trying. Yes, the need of the hour is to innovate to meet needs. Over 40,000 extra isolation beds have been also prepared by converting 2,500 railway carriages.
Wow.
So the whole railway has been converted into the isolation wards. In addition, health facilities available under defense, our railway, paramilitary, labor and other state government institution has also been used.
Okay. PM CARES Fund that was set up to provide relief to the affected people of India. It includes big names such as Tata, Reliance and Wipro who contributed towards this fund. Can you please tell us a little more about this fund?
To deal with this kind of emergency and distress situation which is posed by the COVID-19 and to provide relief to the affected, a public charitable trust under the name of Prime Minister Citizens Assistance and Relief in Emergency Situation Fund, which in short form we call it PM CARES Fund, has been set up. The objective of the fund is to undertake and support relief and assistance of any kind relating to the public health, emergency or any kind of emergency, calamity or distress, either man-made or natural, including the creation and upgradation of healthcare or pharmaceuticals facilities, other necessary infrastructure, relevant research and other type of support. So this fund is like multi-dimensional, has multi-dimensional use, and to render financial assistance, provide grant of payment of money or take such other steps as may be deemed necessary by the Board of Trustees to the affected population. If you have time, I can brief you who all are the part of the PM CARE Fund. Prime Minister is the ex officio chairman of the PM CARE Fund, and Minister of Defence, Minister of Home Affairs and Minister of Finance, Government of India are ex officio trustees of the fund. The chairperson can nominate 3 trustees to the Board of Trustees and shall be eminent person in the field of research, health, science, social work, law, public administration and philanthropy. The fund consists of entirely of voluntary contribution. Anybody can contribute into the PM CARE Fund, 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 CARE Fund. This will qualify under this 80G section of the Income Tax Act of India for 100% exemption, tax exemption.
PM Modi is being admired and looked upon as a global leader especially during this COVID epidemic. He has even managed to get every citizen to follow the lockdown. How do you think he has done this? And 2, how do you think we can get it right in South Africa?
See, first of all, our PM is very charismatic. And also, Prime Minister has taken lead to mitigate and the spread of this crisis in our neighborhood, not only in India. We did an extraordinary SAARC Leaders Summit over video conference on 15th March. And Prime Minister set out a series of measures, including he committed to provide $10 million towards health assistance to all SAARC countries. We have been able to deliver medical supplies and assistance to Maldives, Sri Lanka, Nepal, Bangladesh and Bhutan, all our SAARC friends, and other needed commodity to Nepal and Afghanistan. We also have undertaken medical commodities to Myanmar, Seychelles, Mauritius in our extended neighborhood. And also we have sent medical assistance to Italy, Iran, China, UK, USA at the height of the crisis in those countries as well. So, and in keeping with our standing as per the major and responsible provider of pharmaceuticals product, not only to partners like Spain, Brazil and Israel, but also to another 25 countries in our neighborhood. So, in Africa, and in Latin America and in Caribbean also. In future too, we will examine all the requests for such supply on a case-to-case basis, and then we will extend help wherever possible. And PM has taken the lead. That's why he's not appeared as the global leader because, he's speaking or he's motivating, and he has really done on the ground, and he helped the countries across the world. As you must have seen that we have also considered giving the hydroxychloroquine to more than 13 countries, including USA and UK, because that is the solution. They are further research to be done, but that is the combination they are using for the COVID-19 treatment.
Okay, I've got a question on that. We'll come to that shortly.
Yeah.
But can you please share some stats on COVID-19 cases in India prior to and after the lockdown, just to give our viewers and listeners an understanding of the importance of staying at home?
We started partial lockdown within 52 days of the first case, by which time we had only 451 active cases in India. We moved to full lockdown on the 55th day of the outbreak in India with only around 600 confirmed cases. Other countries have undertaken full lockdown only after the case loads rose beyond several thousands. So a large part of Indian population, including the rural areas, they are able to make this lockdown very success. That's why the corona doubling rate has reduced from the 5 days to 7 days. And then, as you have mentioned in the beginning, we have around 11,500 cases, active cases right now. Recovery rate is quite high in India, and the death is contained below 4%. So that is a very, very positive this thing. We are consistently doing the research and then evolving as treatment, and then as I mentioned to you, the isolation bed and everything. People who have done the self quarantine themselves in the house, they are following it scrupulously, not even meeting the family members. You must have seen so many stories in the social media. I need not mention here, but I want to address my fellow Indians who are here, that you respect the lockdown in South Africa as well, because South Africa is also doing very well. And the lockdown has been extended till end of the April, maybe extended further, we don't know, depending on the assessment of the situation. But what we can best help right now is by the staying out inside the house. We have to stay inside to make it success, because fighting COVID-19 is not only the government job, but it is also our duty, individuals' duty to cooperate with the government, and then cooperate here with the South African government to stay inside and then follow the instruction, keep yourself updated, keep safe, keep healthy, and God bless you all.
Okay, now we come to that question we touched on a bit earlier about the hydroxyl-chloroquine. Prime Minister Narendra Modi recently told Israel and Brazil that India is ready to do whatever is possible to help its friends to fight the novel coronavirus, along with the allowing of exporting of anti-malarial drugs, hydroxyl-chloroquine, and raw materials to produce it. Has this drug been shown some positive results in India during the testing?
Yes. Yes. And it is not only in India but across the world. They are as I said, that the further research need to be done. But
so far it's positive.
Yeah, so far it is positive, as they say that the combination of hydroxychloroquine and the azithromycin, a variation of penicillin, is been very useful in treating COVID-19 cases in India. And right now we have to just be cautious that what are the doses. There has been research on the doses, and also some other mixing, the cocktail treatment they call it.
Okay.
So but there has been quite positive response from this combination. So that's why other countries are keen on procuring the chlorohydroxyquine from India, and we are quite helpful in that.
Okay, so we're looking forward to getting a dose of that here to help South Africa.
Yes, why not? South Africa is a good friend, but so far we have not received any request from them. And once we receive any request, active consideration will be given to.
Okay, so I must say thank you for your time. Wish you everything of the best, and together as a global family, hopefully we can get rid of this COVID virus.
Always. I think as you said that the stay positive, stay calm is the need of the hour.
Yes.
And that's what I tell my fellow Indian and then our South African friend. The stay inside, stay calm, stay positive. God has given you see this as an opportunity to stay inside the house, spend time with your family, and we'll come out victorious, no doubt about that. Thank you so much.
Thank you.
Have a good day.
That's Miss Anju Ranjan, Consul General of India. Super J signing out. Thank you.
DJ Super J Lens FM.